Today we're going to do something a little bit different in the fact that we have students that are going to be presenting at Central State's ACSM, which is our regional meeting for one of our major organizations in exercise science. And each of these students is actually presenting at that meeting, so we thought we'd give them a practice run here in front of all of us. So we're just going to go through the order, and first off we're going to have Yang present his information.
So we're talking about like sports science approach for para-athletes, especially with a focus on wheelchair basketball. So what we did before is we kind of did three different components already. So first component is body composition. So we used four-side skin fold methods to measure their body composition. I know it's not the most accurate nor the most reliable methods, but it is the most convenient field methods for the sports. We also did nutrition knowledge, which just done before, and this will be actually the Central State's presentation. If you are sticking around at about 2 o'clock on Friday afternoon, then feel free to jump into the oral presentation. So we find a pretty valid survey, a really brief survey specific for athletes, and then we just conducted on wheelchair basketball populations as well as our normal college age exercise science students, so we can see the difference over there. Last piece was a 2D shooting motion capture. We just used the camera and use Starfish and Canovia to check out the shooting release phase as well as prep phase, the elbow angle, and then all the other angles of the upper body. So if you were here last semester, I believe December 4th, I'm sorry if this is similar information, but now this study has been actually, as of today, it will be published in a week, so just got accepted at a journal. This study mainly focused on the upper body strength and power in relationship to shooting accuracy. So we used hand grip strength to measure muscular strength, and then we used seated medicine ball throw in a chest press fashion to measure muscular power. And then, of course, we take 10 two-point shots at the location over there. That's our shooting performance. So long story short, our findings mainly just suggest, of course, strength and power are important in the sports. However, it is not the sole dependent variable for like your shooting performance or other outcome measures. For further success in those tasks, you will need the skill components, which is your technical training. So here are the same graphs and then the table that we got from last time. So on the right side, we have the correlations, and we can see the solid line is wheelchair basketball group, and then the dashed line are non-wheelchair basketball, so you're able-bodied person or non-disabled person, based on which group you're from. So we can see that for the wheelchair basketball group, of course, there's a strong positive correlation, but when we focus on the non-wheelchair basketball group, that relationship kind of faded away, even turning to a negative correlation, which is kind of bringing out the points over here. And lastly, this is just some of my future dissertation topics. So for now, we already collected some 3D motion capture on shooting with the Dory system we have in-house. We're currently working on using the heart rate monitors, the polar H-stance, as well as some of our newer local positioning systems to capture the competition load as well as training loads either during competition or during training, so we can have a better understanding on their physiological response to a higher training load. And all these equipments will be used for, like, let's say, other off-tangent projects related to wheelchair basketball. So we have isometric strength testing for the upper body, as well as sprinting and agility testings for obviously your linear sprint ability as well as your change of direction abilities. And perfect, 5 minutes.
This is my poster. It's a little bit small on this screen. And today I'm talking about the effect of standing width on the lower body biomechanics during jumping. I will give you some background first. So the counter movement jump is widely used to monitor our sports performance. And it can be influenced by the muscle strength or fatigue, but there might be a factor that has been overlooked, which is the standing width. When we try to do the counter movement jump, we will not have specific guidance on how you how you perform your standing width. And based on our observation during across different sports, there are different kinds of standing width. For example, in volleyball, they try to use a wider stand width to try to have a higher stability and to help them to jump higher. But in jump rope, they try to have a narrower standing width to try to have their energy efficiency. So in all kinds of sports, they adopt their different standing width. So it means the standing width might be a contributor to the jumping performance. That's why we try to look at the effect. However, there are no direct investigators. They have been trying to examine the standing width on the jumping performance, but there are some research on the squat, and they have shown that when you try to do the narrower squat, you have the higher involvement in your sagittal plane movement. And when you try to do the wider stance on the squat, you will try to have a higher demand on your frontal plane. So our purpose is to quantify the effect of the standing width on the jumping performance based on the previous study. So in our research, we recruit 35 participants, and they perform 3 kinds of standing width during their before they jump up. And there are narrow stance width, which is half of the shoulder width, and the wide stance width, which is 1.5 of the shoulder width. And this is the result. Okay, this is, I don't know if you can see it clear. But if we look at the jumping performance first, we can see that the blue one is the narrow width, and the red one is the shoulder width, and the gray bar is the wide width. And if we look at the first row is the jump height and the jumping depth, we can see that the jumping height, when you try to perform in a narrow width, the jump height is the highest. And the jumping depth is highest in the narrow width as well. And when we try to look at the sagittal plane movement, we can see that the highest trunk flexion is in the narrow width, and we have similar knee flexion angle and ankle dorsiflexion to the shoulder width. Narrow width has the similar knee flexion and ankle flexion to the shoulder width. And this means narrow stance width is associated with the highest jump height, and narrow shoulder width also promote hip and ankle alignment in the frontal plane. And when we try to look at the frontal plane movement, we can see that the hip abduction angle is the highest in the gray bar, which is the wide stance width. And we can also see the knee valgus angle is the highest in the wide width, and the ankle inversion angle is the highest in the wide width. It means the wide stance width resulted in limited vertical jump performance, but it has a greater demand on your frontal plane. It means maybe we can use the wide standing width as a training program to train our frontal plane movement. Yeah, that's all. Thank you.
Any questions before you take off?
Oh. Yeah.
I got a question. So, did you measure, and maybe you said I missed it, what their preferred width is and how that compared to what the 3 values that you used for your experiment?
So we did not, good question. We did not measure the, we did not like ask for their preferred standing width, but I would say usually when people try to do the counter movement jump, they will just adopt to their like shoulder width. So we just compare different width, like compared to the shoulder width. But we did not ask.
Higher with a stance that's narrower than they would naturally choose.
Yes, like based on our study. Yeah, it's higher than their like shoulder width and wider width, which is they will choose shoulder width more. Yeah.
So what was the depth again? For between the three groups, three conditions, was the narrow one the deepest before they took off? Or was it the opposite?
So the number is the highest. So we try to measure, the jumping depth is we measure the hip, the distance from the hip to the ground. Okay. So the highest number means they're far away from the ground.
So less?
Yes.
Less than, okay.
Yeah.
I was just going to ask for the absolute magnitude difference between the narrow width and the shoulder width. What was that difference in jump height? How big of a difference was it?
I'm sorry, I didn't get it.
You said that they jumped higher from the narrow width.
Yes.
Compared to the shoulder width and the wide width. Do you know how big of a difference in jump height it actually was?
So I knew, but I don't remember. But we can see the average number of the jump height for the narrow width is 0.44 meter, and the shoulder width is 0.42 meters for their average jump height. And the absolute number, I don't remember.
So you can calculate effect sizes for those?
Yes, we already calculate that. Yeah.
So do you know what they were off the top of your head?
Right now, I can look it up, but right now I don't remember.
And first is the introduction part. The ACL injury is one of the most prevalent knee injury. It has pretty high re-injury rate, so it's critical to develop sensitive assessment to monitor rehabilitation progress and screen for ACL re-injury risk. After ACL injury, the weaker quadricep strength and the reduced knee extension moment are commonly observed on the injured side. Not achieving a center bilateral symmetry is a risk factor for ACL re-injury. It indicates the insufficient knee recovery. In the PT clinics, the physical therapist will usually apply the single leg forward hopping and vertical hopping to identify the patient are ready to return to play or not. And achieving similar hopping performance between legs will regard the patient are ready to return to play. However, the single leg forward hopping does not isolate the knee, but rather incorporate the hip and ankle to compensate for the injured knee. The vertical hopping may be a better matrix to assess knee function due to it will involve the knee more. However, the vertical hopping will usually require extra equipment such as a jump mat and a vertex. It may limit the live feedback that can be provided by the clinicians. As such, a low-cost, convenient, and sensitive task is needed to effectively assess the knee function in clinical settings. In addition, the quadricep strength is also evaluated with dynamic knee function after ACLR. And the electromechanical dynamometer is often regarded as a golden standard to measure the knee strength. However, it's pretty expensive. In clinical settings, they will usually apply some more accessible tools, such as this handheld dynamometer and the tape measure. However, there is a pre-agreement between the dynamic knee function and the golden standard strength test. The quadricep strength and the mass cross-sectional area measured by ultrasound image also show a pro-agreement. It indicates that isolated knee function assessment or quadricep strength evaluation may not fully capture the knee recovery. Therefore, a comprehensive assessment of dynamic knee function and quadriceps strength using clinically feasible tests is critical after ACLR. In addition, our previous study found that the single leg backward hopping may be a better matrix to assess knee function, since it will impose the greatest knee mechanical demands than forward and vertical hopping. Therefore, the purpose of this study is to assess the knee mechanical function during dynamic task and the quadriceps morphy in both ACL patient and healthy control. We want to identify more practically and clinician-friendly metrics to monitor rehabilitation process. There are two specific aims of this study. First, we want to identify the bilateral symmetry in knee mechanics and the quadriceps strength between ACL patient and healthy control. Second, we want to determine the relationship between clinical assessment and the golden standard measure in both groups. A minimum of 30 participants in each group will be recruited. And in our study, the participants need to visit twice. For the visit one, we will do our biomechanical session. The participants need to perform the double leg counter movement jump, vertical hopping, forward hopping, and backward hopping with motion and force data collected. In the session one, we will use ultrasound to get the image of quadriceps and hamstring. We will also use the handheld dynamometer and the electromechanical dynamometer to measure the quadriceps and hamstring strength. Oh, okay. So in terms of the current state of this study, first we got our IRB approved, and we did several pilot studies last semester. And this is an ongoing project. We have completed the biomechanical testing on 20 unilateral ACL patients and 30 healthy controls. Okay, that's it. Thank you.
Any questions for you? You.
Okay.
Quick question. Maybe going back to the backward hopping, and that's probably from previous work. I'm just curious, have you investigated how much vision plays a role in that difference from the backward movement to the forward? And have you ever tried forward movement with eyes closed to see if that changes muscle activation?
The muscle activation part, open eyes or closed
Yeah, just
eyes?
thinking you're jumping backwards, so you're not seeing where you're landing. I'm just wondering how much visual perception has a role to play in that.
Oh yes, I also think about this question before, and we think about when we doing the backward hopping, we can put a mirror before the jump, so they can see.
Mirror, okay.
Yeah, we want to. Maybe we need to do some research like this later. Yeah, I think I really think about this question before. Yeah.
So what is the marker for return to play then? Would it be distance, or what are you looking for between the two? Like, so this is popped back, or what's the between their right and injured leg and non-injured leg? What would be the I guess the critical, like this is your 90% distance between the two, or what would it be?
Yes, the 90% between the injured leg and the uninjured leg.
And that's just distance, all it is, right?
Yes, in the clinical setting, they will commonly just measure the hopping performance, the hopping distance.
Okay.
Those of you that don't know me, my name is Maddie Rink, and I work in the Jayhawk Athletic Performance Laboratory, and I'm a second-year PhD student in the Exercise Physiology program. And then I'm also a sports science intern, and I work directly with KU football, and that's where I spend a majority of my time. And so today I'm actually doing a data dive on Friday where I'm going to present my ACSM presentation then. So if you want to come to the JAPL meeting on Friday and look at that, you're more than welcome. But I'm just going to kind of go over some of the projects that we've done with football, with our Gridiron Performance project that we've been running with Dr. Johnson and the KU football program. So some of the things that I'm interested specifically as a sports scientist is in training load monitoring. So some of the projects we've done is looking at external loads during fall training camp. over across 2 seasons. So we looked at 2023 versus 2024 for things such as volume, intensity, density, and what the differences were in those practice training loads. Especially because from 2023 to 2024, we went from 14 soft tissue injuries to 0, and that's huge for fall training camp. So we just wanted to see some of the differences in that. And then the next project we looked at was the in-season external practice loads. So basically just looking from day 1 to day 2 to day 3 to day 4, how do those practices differ across your training loads? And then the last one, and this is the one that I am presenting at Central States, is quantifying in-season contact loads. And contact loads is something that we get directly from global positioning systems that lets us know how many contacts or tackles, blocking, those sorts of things get accumulated during a practice. And we split that up by pad level as well to see if there's any behavior change between wearing spiders versus shoulder pads, or wearing spiders versus half pads versus full pads, which is, wearing girdle or not wearing a girdle, but still wearing a helmet. And then another research interest of mine is relationships between internal and external loads. So your internal load is how your body's actually responding to that training stimulus or that external load. So one of the projects we looked at was the relationship between internal and external load during fall training camp. So we specifically looked at player load, which is synonymous with workload within the sports science realm, and its relationship with soreness during that preseason time frame. And we found that there was a moderate relationship, especially within that week 1 and week 5 time frame. So for sports practitioners, that's lets us know that within that first week of fall training camp and that last week of fall training camp, we want to make sure that we're really recovering guys, making sure that their nutrition is on point, hydration is on point, and making sure that those athlete monitoring initiatives are up to par. And then we also evaluated lower body neuromuscular fatigue and external workload during a competitive season. So that was looking more at counter movement jump over across a time period. So that full season. And the most interesting thing we found with that one was that there wasn't a significant effect from time to position group, which basically tells us that no position group was seeing more of a decrement in performance than any other position group, which is huge because that means that we're doing our jobs as strength and conditioning coaches. And then for athlete readiness and performance monitoring, we did a study for test-retest reliability of counter movement jumps, specifically in the American football population. And we found that bigs actually are more reliable than our mids or our skill positions, which was pretty interesting. And then last one, we just explored the cardiovascular response of one of our defensive tackles that has sinus tachycardia. So that was an interesting one because every single day he was always above his age predicted heart rate max. So lastly, just future research and dissertation topics that I'm interested in doing is training load management and how can we use like mixed model approaches for prescribing and predicting training loads through more of a chronological perspective. So looking at it from a macro cycle lens rather than just your mesocycles individually. And then same thing with like internal load monitoring. I'm very interested in subjective monitoring and heart rate and cardiovascular response. So, yeah.
Any questions from the gallery?
How are you quantifying load? Just reps by sets, or?
So we quantify it using a global positioning system, and the one that we use is called Catapult, and basically it gives us player load, which has a like software programming setup. The equation is like all of the accelerations in the triaxial plane squared, square root of it divided by 100.
Is that including like skills practice plus resistance training?
Just practice. Yes. So that would be during like field-based conditioning, they will wear them, but during resistance training, like down in the weight room, they don't wear that. So we don't quantify that necessarily in.
That's relevant?
Yes. Yeah, it is.
So what, just for someone that's familiar with your research, what are external loads then?
So external loads is any training stimulus, so it could be what's happening in the weight room, but for us and how we define it at KU football is looking at those GPS metrics specifically. So
Okay, so environment's not taken into account for that at all, or?
in terms of like heat and stuff like that, it is, but like for these projects, it was not.
Okay.
Yep.
Any more questions?
For measuring the training load, external training load, you said you use the global positioning,
Yes.
and is it just measure the distance that they, or agility, or all the things that they, propose in the training?
Yeah. So the global positioning units that we have also have an accelerometer in it as well. So that gives us velocity and those sorts of things. So we're getting distance, velocity, and then that player load metric as well. And then there's different metrics that get derived from those buckets, essentially.
Are you using the heart rate monitors?
Yeah. Yeah.
So how are you relating that? How are you relating player load to their actual heart rate?
We're haven't yet. Yeah. Yeah. Like Dr. Weir hates first beat, so we don't typically first beat. The heart rate monitor I brought up in exercise, yeah, cardiovascular. So we're very hesitant to use some of that data just because it can get really noisy, and is it reliable? We're not entirely sure. So we haven't actually necessarily explored those relationships just yet, but we do use it in terms of just seeing if there is any improvement in like average heart rate during like 300-yard shuttles during winter training, and then peak heart rate as well.
So have you, sorry, I'm going to ask, but so have you thought about, like, if you're talking about managing player load, then have you thought about figuring out how to quantify their actual recovery and how quickly they're recovering during a session by using heart rate?
Yeah, so you can use like a heart rate recovery metric, but the issue with it being an applied setting is I cannot get these 50 players to wear their heart rate monitors longer than they need to. So unfortunately, like the minute the conditioning is over, they're throwing that thing off. So it's very like, could I have them wear it for longer than I needed them to? Probably not. So that makes it harder limitation on getting some of that heart rate recovery unless it's within that actual exercise session, if that makes sense. So in between like bouts or like in between drills and stuff, you could quantify that heart rate recovery, but from the actual after the session, we probably wouldn't be able to do that.
My name is Sam. I'm in my second year of the doctoral program under mentorship of Dr. Quincy Johnson. And so my approach to this presentation is a little bit of just an overview of all the projects that I have been fortunate to work with. Similar to Maddie, I work with the football team. So truly as a strength and conditioning professional, but also really trying to understand what we can do as sports scientists. And that segues to the current research and the model we like to approach our research is with assess, monitor, and develop. And so I will be talking about a couple different opportunities and projects that we've done with the football team, but a couple others involving the track team on campus and helping out another doctoral student, Min, with some of the soccer teams that he's been working with. So at the center focus of everything is athletic performance. The athlete is in the center. We are trying to help the athlete in whichever way we can do that, whether it be a physical standpoint, it could be recovery like Maddie was saying. There's also nutritional sides of things. So we're trying to understand all of these different aspects to improve athletic performance. So for the couple of projects that I've been involved with, first and foremost, my focus has been related more towards speed development. So at the basis of everything, still trying to get this paper published, this narrative review, doing some revisions on that. It is just going over the basis of what is American sprinting, or American football, what is sprinting? What is it related to? We get into some of the biomechanics a bit. We get into some of the force velocity curves, things to that extent involving American football. And so in this, we were able to really get a good understanding. It was pretty extensive narrative review. The literature was saying that the exposure to high-speed sprinting is very important. The overall demands, similar to we were just talking about with catapult, being able to accumulate the total distances that are being achieved in a practice, in a game, and then how do you, again, like I was saying, monitor those throughout a week of practice, up into a game, and then across a whole season, and then across multiple different phases of an athletic calendar. Another project, one of my first projects actually on campus that I was able to help with, I think it was a part of this first picture, the second picture. Over across the street, we're able to work with the track team, and slightly a little different from American sprinting just yet. We were trying to look more so at the drop jump forces and how that could then relate to some sprinting performance within those sprinters. And in that one, we were able to see that there was significant relationships between the eccentric portion and the concentric force production, with how that transferred into jump height, and there was no differences relative to the genders of the athletes. That segued into another opportunity with the track team to get some differences, more so now looking at differences between skill level, between genders. We were fortunate that we were able to have really kind of just strolled into the gym and then was able to get everything signed, informed consent, but with an Olympic level athlete who is a part of the track team across the street. And so we were able to look at some of the differences skill level wise and kind of used our Olympian, his data collection as kind of like a leverage and compared to see some of the difference between them. And so a lot of, this one really showed a lot more maturation, things to that extent, where some of the differences in sprinting approach to change or to show some of the changes within the sprint production performance that they were able to have. And still trying to, we did a good amount. This was the follow-up visit when the track team came to our lab upstairs in the JPL. We were able to get a couple different tests with them, but this was now more so looking at the neuromuscular strength and power related to them. So we were able to get them on the IMTP and look at relative and absolute strength differences. And so with that, able to try to relate some of those across genders as well. And then taking that concept towards the football team with some of the guys who were preparing for the Big 12 Pro Day, looking at some of the differences and relationships between their jumps and their sprinting data. And that kind of full circles back to where I'm now. Now I'm looking more so at the differences between position groups, offense, defense, skills and mids between American football athletes. So kind of full circled everything relating to sprint performance and power related attributes. And then now segueing into where I'm looking to go now, as I've been hovering around sprint performance, we're now trying to dive more into hamstring strength, relative impulse, max production within the hamstrings. I have accumulated a bunch of data that we get from the GPS metrics with the catapult, looking at how do those different volumes in the high-speed sprinting that we talked about in the narrative review, how does that relate across an entire season? So practice to practice to a game, what were some of the changes throughout the periodization of an entire season? So a couple of different projects we're looking to do, and hopefully we can try to get everything done and write it all up as we do. And that is, I think that's it. Yep.
Any questions for Sam? I have a quick question. So yesterday I was at a dissertation, comps meeting, and so Angela was talking about resistance sprinting. Does the sprint team do any resistance sprinting at all? The
The sprint team,
Or they just do mainly just explosive type stuff?
I believe they do some banded stuff.
Okay.
Over with the football team, we do sprint with the 1080. So that's how we was able to get a lot of the data. More on a consistent training measure though. They do sprint with chains and different size chains. So that's more of a
Good.
way to provide a velocity decrement to get them to either pull back some of, like, so the beginning of the season, once we came out of winter break, trying to get some of the guys reacclimated into sprinting. So we use a heavier chain to try to get a bigger velocity decrement and then wean them off into a smaller chain and then into unweighted free sprinting. And then after that point, was able to collect some data. And so trying to see where those players are now at. But yeah, with the track team, I think they do bands, but I wouldn't be surprised if they use chains as well.
Any other questions for Sam? All right, thanks, Sam.
Oh,
Wait, one more.
that one.
Sorry, Shadi?
What about the injury prevention? Do you have some program to collect the data related to their injury, for example, after one season, preseason, postseason?
So specifically with the football team, we work very tightly with the athletic training staff. They're literally next door, and they come in and out. So we have plenty of conversations throughout the day. But with specific injury prevention, we're trying to get exposures through different area groups. So trying to cover different groups that are the more common injuries that are related to American football. So your hamstrings, your groins, things to that extent, soft tissue injuries, similar to what Maddie was bringing up. So trying to get specific exposures and relative volumes based off of the current strength and conditioning staffs. What they have found over the last 6 or 7 years was an adequate volume, so reps and cents and exposure-wise, total time under tension within those different areas of those soft tissues. So that's been their way of going about it. It's kind of, at the moment, I am trying to gather up essentially a year plan into main lifts, accessory lifts, exposures to different tissue areas to see how that could relate to some of those things. Like, so for example, with the Nordboard, we do have some guys with asymmetries in their hamstrings, things that they have been lingering issues for them over a period of time. So that is why I wanted to get into this study, to look at what is some of the differences with position groups and with some max production impulses, asymmetry differences within the hamstrings. And so from that, other VALD technologies, we could do some things with the adductors and abductors, but kind of just starting off with the hamstrings.
My name is Tanner Reese. I am a first-year doc student working with Dr. Joe Weir. So thanks for his mentorship these last few months, and thanks to Dr. Yuson and her lab for giving me some data to play with. All right, so ACL injuries, very pervasive in contact sports. I think we can all appreciate that. It's been reported that about 60% of these injuries occur shortly after some sort of unanticipated trunk or upper body contact prior to landing. This has been consistently shown in laboratory studies that look at both single leg and double leg landing. But it turns out that perturbation studies that answer these types of questions, we can probably have a good working sense of how they work. Participants come in, perform like repeated jumps, landings in a very laboratory setting. But what we kind of wanted to look at is to see whether there's some sort of like motor learning, rapid motor learning going on that might confound or underpin some of the results that are typically seen. So if I can play this. So we had 33 participants come in. Here's the control condition. So backing up a little bit, participants would jump from a double leg stance and land on a single leg. So the control condition, that's all that happened. They jumped, they landed on a single leg, nothing else happened. And then we had two experimental conditions. So in the contralateral condition, same thing, they jumped, but before they landed, shortly after they jumped, right around their peak jump height, they were knocked off balance by this perturbation. Contralateral here just meaning the opposite side of their landing leg. So, and then the other condition, very similar, but ipsilateral, now the perturbation is going to happen on their landing side. So they jump, they're knocked off balance, they land. So this is reported to be a very prominent mechanism of injury in ACL injuries. So we had the one control condition, and we had these two perturbation conditions. For the perturbation conditions, subjects performed 6 trials of each. For the control condition, only 3. So we have 15 jumps total, randomized in order, so that the participants would jump, but they wouldn't know, A, if they would be perturbed at all, and then if they were perturbed, they wouldn't know which direction it was coming from. And what we did was, shortly after they landed, in the first 100 milliseconds after that single leg touchdown, we recorded knee kinematic and kinetic measures, trying to look at how biomechanics might change, not necessarily as a function of condition, but as a function of trial. So basically we looked at the differences between the first and the last trial, seeing if, okay, maybe it's the case that they just get better at learning, or a bit more accustomed to this, what started out as maybe a novel task, but maybe after 4 or 5 trials, maybe their mechanics changed a little bit without them even really knowing that might have altered their landing mechanics. Oops, sorry, there we go. So when handling these types of data, we collected 100 milliseconds of time series data. We wanted modeling to do 2 things. One, we didn't want to throw away any information or aggregate or discretize these signals in any way using averages or peaks or minimums or anything like that. So we modeled the entire signal. And then another important aspect that we wanted to take care of was handling, to the best of our ability, the natural sort of dependencies in our data. We have subjects performing in 3 different conditions. And then within each of those conditions, like I said, we had repeated trials. So it's very important that when you're modeling these types of data, you want the models to propagate that uncertainty appropriately. So really quickly, so looking within condition, these are basically, we have knee abduction angle, knee abduction moment, and these curves represent the average, think of these as population level trajectories. So the green is the last trial that occurred for the control condition, and the red is the first trial. So basically, what we're interested in is the difference between these 2 smooths across the first 100 milliseconds of that initial landing phase. And to hit the high points here, it turns out that for the ipsilateral condition, roughly the last half of that early landing phase, basically 60 milliseconds to 100 milliseconds, knee abduction angle was higher for the first trial compared to the last trial, as seen here by basically this uncertainty, this credible interval not including 0. But really quickly, to take things a step further, in causal inference, it's commonly something called the difference in differences contrast, and essentially all that's getting at is, okay, we see changes looking within condition, but it might be good to know if that change rises above or below what would just happen naturally under repeated control conditions. So that's what's obtained over here. We're basically taking the difference from this blue curve, difference of this blue curve and this blue curve, basically contralateral versus control, and then ipsilateral versus control. And what stands out is that basically what's happening here is indeed different than just changes from repeated jumps with no perturbation at all. So that's kind of where we're at right now. We have some other outcomes we might investigate, but we're actually meeting later this week to maybe talk about the biomechanical implications of this work and then future directions that might be interesting to go off of from here. I'll take any questions. Yeah.
So you said compared to a first jump, just to kind of get a baseline, and then some of the references there was no perturbation?
Yeah. So before the participant came in, and Dr. Son and her lab mates can correct me if I'm wrong, I had no part in collecting the data, so thanks to them again for collecting it and letting me use this. But we had 15 trials, 6 in each of the perturbation conditions, 3 controls. We shuffled those up in a random order, and then the participants completed all 15, so it could have been the case their first jump had perturbation. They were knocked off balance at their very first try, and then it could have been the case, because it was randomized, they could have had the same perturbation condition twice in a row before they had like a control condition.
Okay, I guess my question may be off a little bit. I wanted to see if the repetitions where they didn't get any perturbation, was there a drop off of the jump height?
Oh, I didn't.
As if they were anticipating it, but they didn't, so they didn't jump as high. Does that seem?
That's an interesting question.
Yeah, but I think this study, we reported all those peak values and other biomechanical variables in terms of jump height. We didn't find any significant differences if that remember the results right. And here we're kind of trying to see the trajectory if we see like provided more information in terms of learning.
Yeah. So all the outcomes, I showed 2 here today. We have a few others that we're kind of looking with, but everything here is measured when they land, the first 100 milliseconds afterwards. So looking at the mechanics of landing and how that's influenced by repeated perturbation trials.
Is it actually fatiguing then, or is it just? I mean, it doesn't seem like 15 jumps would be that fatiguing. Right?
You could jump much.
Yeah.
You could do it. Yeah, that was our threshold. Could Phil Gallagher do this? And then,
Don't get me wrong, you're tough for me.
but what was the recipe? I mean, it was. I didn't collect the data, but participants presumably felt okay jump to jump. I'm not.
I think so. Especially overall the data collection was controlled within 1.5 hours, including consent form, everything. And we do have the breaks controlled between trials. And now participants said they will not be able to handle it or anything. I think this part is really challenging because those the balls is 10 pounds and they do not know if the ball they will be pulled or not. That could create some stress at the beginning. Later on, they feel pretty confident of dealing with this. And also why we are trying to look at the differences between the beginning and the end.
Yeah.
So my follow-up question to that is the difference of the differences here, is that good or bad?
I don't know.
It is.
It is.
It is. It is what it is.
I mean, I don't know. I'm not a biomechanist, and we'll talk later this week. But I think and motor learning is kind of a catch-all term. But what an anticipated trunk perturbation means in a laboratory setting is very different than what an unanticipated trunk perturbation would mean on a football field. Because at the end of the day, participants came in, they were explained hey, this is going to happen, and then the perturbations here probably on a lot smaller scale and one of 2 directions versus virtually infinitely many directions in a real world setting. That's kind of where I'm at. But any other questions?
Well, I'll just make a comment. So
Sure.
what I think Tanner's probably underselling here is just the utility of this approach, these general additive models, to look at trajectories as a source of information as opposed to just discrete values, like commented, right? Peak, min, average, stuff like that. It really opens up a ton of doors for exploring signals in a way that I think we're just scratching the surface of.
Yeah, I get just preliminary type of stuff where we don't. But my question about is it good or bad? I guess if we don't know, we don't know. It's just we're trying to figure it out right now. We're in the process. I get that.
I would say it's not that bad. It didn't show much significant differences, and most of the ACL injuries from video analysis happened before the first 15 milliseconds, and it's kind of happened a little bit later during for this knee abduction angles. That literally means at the first trial they were in a more knee-in position after first 15 milliseconds. It's also not the primary ACL loading variables. Overall, the results actually supported why we're using average across trials. So that's kind of good for us.
Any more questions for Tanner?
Hello everyone. Today I'm going to present my project titled Backward Hopping Distance is a Stronger Indicator of Quadriceps Strength Than Forward Hopping. So a single leg forward hopping for distance is a widely used clinical assessment to evaluate quadriceps strength. but studies show that the forward hopping distance can be compensated by your hip and ankle, which mask knee strength. So, which means the forward hopping for distance may not be a good task to evaluate quadriceps strength. And the recent studies show that the backward hopping for distance might be a better task to evaluate the quadriceps strength. So based on that, the purpose of this study was to determine the relationship between the quadriceps strength and a single leg forward and a backward hopping distance to indicate which direction will be better to predict the quadriceps strength. And in this study, we recruited 34 participants, and each participant performed both single leg forward and backward hopping with their maximal effort. And the hopping performance were measured by distance. And in addition, we measured their 1RM quadriceps strength using leg extension machine. And the focus of this study, we tried to use multi-level modeling to analyze which direction is more associated with the quadriceps strength. So here we have 3 steps. So the first step, we create a baseline model, which is the empty model. And the second step, we put either the forward performance and the backward performance into the empty model to see whether the model fit increase or not. And the last step, we create a combined model, which includes both forward and backward performance to see and compared to the models we create on the step 2 to see whether there is a further increment in the model fit. All right, so now let's look at the results. So these 2 graphs represents the comprehensive model comparison between the empty model to the forward model or backward model, and also the comparison between the combined model and the forward and backward model. So the x-axis represents the type of models, and the y-axis represents the raw AIC value. So keep in mind, the lower AIC value you have, the better model fit. So let's look at the left panel. So when we add the either forward and backward hopping distance into the empty model, the model fit increased, indicated by the decrease in the AIC value. But importantly, after adding backward performance into the empty model, the model fit significantly increased, indicated by the greater decrease in the AIC value. And now let's look at the right panel. So after adding backward performance into the forward model, consistently the model fit increased, indicated by the decreased AIC value. But in the contrast, after adding forward performance into the backward only model, the model fit decreased, indicated by the increase in the AIC value. So therefore, our results suggest that the backward hopping distance demonstrates a stronger association with quadriceps strength compared to the forward hopping. In addition, the backward hopping for distance might be a good task to evaluate quadriceps strength in clinic. All right, thanks.
So I think during Wanyan's presentation, there was a bullet point about backward hopping is more focused on the knee moment, right? Whereas forward, you have a lot more hip and ankle. Is that kind of the big picture here of why backward hopping is potentially a more useful proxy for quadriceps strength, is because it's so focused on the knee moment?
Yeah, that's kind of the idea. So because the studies show that the forward hopping, you can compensate by your, you can use more your hip and ankle to perform better, get a longer distance compared to the backward distance.
when people do backward hopping a lot, do they get better at compensating with the hip and ankle?
That's been my question.
Like forward hopping is common, right? So we
Yeah.
sort of practice it a lot. Maybe we get kind of game how we, distribute torques across the system, right? But backward hopping is more novel, so our initial learning is just focus on the knee. But if I get better, maybe I can get better at hip and ankle too.
That's a good question.
I know.
To answer this, there are two parts. First part is if you look at the tangential velocity of your knee joints, when you extend
All right, slow up. Tangential velocity.
Well,
Let's make
yeah.
sure you write this down.
It's more about thinking about how your knee and elbow designed relatively to your hip and ankle, as well as your shoulder and wrist. It's kind of in the other way. And that way, that special part, the design of the knee, really makes the backwards hopping more sensitive to detect or involve more of the knee. And the other part to answer, more quantitative or with the results, you should be able to answer that. We had a study currently under review. We reported how people repeated hopping with maximum efforts for 10 trials, and to look at if there is a significant increase in terms of your hip, knee, and ankle. And I do not think the performance increased, the hip contribution increased in that case, right? Okay. But overall, knee contribution, if you are thinking about percentage, when you're hopping forward, you're about 30, 30, 30, kind of equivalent for your three joints. But when you're using hopping backwards, your knee contribution is significantly more than hip and ankle.
So if I have an ACL injury, is doing a knee extension strength training task, does that put more load on the repair than what would happen at the knee with the backward hop? It just seems like the shear forces are.
That's also touched on Phil's question earlier a little bit. At this stage, we won't be able to tell what is your return to sports or criteria. We are just our study design doesn't allow us to tell what is your percentage. But then for that, quadriceps atrophies is commonly happen after ACL reconstruction. That's why we're thinking, evaluating quadriceps strength could be critical. And to do some extension, it does add a little bit of load on your ACL, but not that much if you are not doing some weight bearing, if you are doing some open chain tasks.
Any more questions for Jason? Thanks, Jason.
When thinking about musculoskeletal and metabolic health after surgery, there is a gap in the literature. So what can be discovered within this gap is very important for clinicians and patients because it can inform therapeutic strategies for achieving optimal outcomes. This need for information is what drove our study, differences in resting metabolic rate and lean body estimates between joint groups following orthopedic surgery. Before explaining our results and conclusion, it is important to understand why this study was deemed necessary. So, for an overarching background, orthopedic surgery induces a hypermetabolic and inflammatory cascade, and this surgical insult causes inflammatory cells to flood to the area for healing, which places the body or the limb in a hypermetabolic state. While inflammation increases, lean body mass usually atrophies due to muscle catabolism and limb immobilization. The strong correlation between lean body mass and RMR would cause us to believe that RMR would decrease after surgery. But we have the opposing side that would tell us that because there is a hypermetabolic state being induced, RMR would increase. Therefore, the changes in RMR after surgical insult are unknown, and the literature focuses primarily on bariatric surgery and trauma injuries. After bariatric surgery, lean body mass and weight decreased and RMR decreased, and a similar trend was seen after hip fracture surgery. In trauma injuries, RMR increased in burn patients by 132% and skeletal trauma patients by 32%. And so these studies obviously leave some lingering questions. So the purpose of our research was to evaluate changes in RMR and lean body mass throughout 12 weeks of recovery from orthopedic surgery and comparing 3 joint groups, the knee, hip, and shoulder. These results can inform nutrition and rehab strategies to help achieve optimal metabolic and functional outcomes. So we recruited 29 pre-op patients undergoing knee, hip, or shoulder surgery within 1 month of their surgery date, and the patient demographics are listed below. Visits were conducted pre-op, 1 week, 3 weeks, 6 weeks, and 12 weeks post-op, and it consisted of a dietary recall and activity log. Caloric intake and physical activity factor were included in those. We also calculated macronutrient intake. A urinalysis was conducted and a body comp assessment using an in-body BIA device, and then we got lean body mass, appendicular lean mass, and various body comp measurements from this scan. And then lastly, the RMR test was conducted using indirect calorimetry, and there was a 5-minute resting period followed by a 10-minute testing period. Our results that you can see down below showed that there was no group by time interaction for both RMR or lean body mass, and no change in RMR or lean body mass over time. There was a main effect for group denoted above, with the knee patient group having a significantly higher average RMR than hip patients, and then no differences between knee and shoulder or hip and shoulder patients. We do hypothesize that this could be due to physical activity levels and smaller changes in lean body mass for shoulder patients. The musculature of the shoulder joint is just smaller in mass than quads, hamstrings, and hip musculature, which in turn could influence RMR. There was a main effect for group for lean body mass, with a difference between knee and hip and shoulder, and so the shoulder joint group did have a higher average lean body mass. Once again, it could be due to the size of the musculature. Overall, RMR varies slightly between the joint groups. The inter-individual variability within those groups is important to note as a clinician, as physical activity, caloric intake, lean body mass, and inflammation can alter RMR. There were no significant changes seen in our study over the 12 weeks, although it should be noted that the patient visit compliance was not consistent, as some visits were missed or body comp could not be completed due to weight bearing or shoulder range of motion restrictions. The shoulder group also had a smaller patient enrollment, which could have influenced results, but in conclusion, clinicians should monitor protein, caloric, and macronutrient intake and optimally load limbs in order to maintain lean body mass and subsequently RMR. For future directions, the relationship between macronutrient intake and RMR during recovery should be investigated, and we are looking into this as a lab group. An interventional study supplementing calories or protein could be valuable to see if that impacts lean body mass or RMR, and monitoring RMR over a longer period of time, and perhaps in an athletic population. So in conclusion, this study provides a baseline and a starting point for tracking fluctuations in RMR and lean body mass over time, which is crucial for clinicians and patients alike to be educated on. Thank you guys for your time and attention.
Those of you who are still here and who have the time to be here. Tricia did a great job. I'll be sure to text her and let her know that her presentation was wonderful. We were working with the same data, but clinical populations as a whole are very unique. Each individual subset within the clinical area is extra unique, and orthopedic surgical patients have their own special qualities that Tricia touched on. We know that after orthopedic surgery, we have hypermetabolic response, and we also have an inflammatory response in order to stimulate healing of the body. We also know that even anecdotally, when you look at somebody, that there is reduced muscle mass. So we're looking at muscle atrophy, we're looking at muscle catabolism, so we're seeing a loss of what we call lean body mass. And when we say that, we're thinking about muscles. However, the changes in resting metabolic rate is not known within this type of population, which is why this study and this research exists. We have identified that there is a strong correlation between lean body mass, so how much muscle we have, and resting metabolic rate. There are prediction equations that everybody in the sports science world, exercise science world has heard of, which are the Harris-Benedict equations and the Cunningham equation. Both of those equations are frequently used to predict basal metabolic rate specifically and resting metabolic rate. However, recent literature has established that because of the uniqueness of these populations, different equations should be used for specific populations due to their demands. This is seen in athletes. There is a newer equation for athletes. I only bring that up because we had the athletes here. So the purpose of this presentation was to determine the predictive evaluation of macronutrient intake and body composition, specifically lean body mass. So we had 29 preoperative participants in this study, and we first looked at their macronutrient, if there were macronutrient changes over time. So there were a total of 5 visits. Their first was preoperative and their last was 12 weeks postoperative. We found no change. There was no significance in that analysis. So we decided to dive a little deeper. And we then decided to start with visit 1, before surgery even happened. So this is preoperative. They are injured or they've been waiting to have surgery on either their shoulder, hip, knee, and we took their data. Specifically, we started with a linear regression to look at those predictive qualities for macronutrients individually. We also use macronutrients to estimate their total caloric intake. And then we also looked at their lean body mass, which was done using an in-body assessment. And then their macronutrients and estimated intake were done using self-report, which was collected at every single visit. Using that data, we then looked at the different equations and calculated and estimated their resting metabolic rate using the Harris-Benedict equation, Cunningham, our predicted regression, which I'll talk about in a moment, and we compared that to their actual, which was measured using indirect calorimetry. Our linear regression produced one significant model as lean body mass or muscle mass as the primary predictor. That produced an equation that was strikingly similar to the Cunningham equation, which was surprising, but pretty cool. We then plugged everything we needed to into that equation and produced these estimates here, which I'm hoping, yeah, down here. So we're looking at this graph right here. We did a one-way ANOVA just to look across these different averages. And what we noticed is that the Harris-Benedict significantly underpredicts what's going on with resting metabolic rate, significantly underpredicts from every single measure, including their actual resting metabolic rate. The Cunningham equation relatively overpredicts in comparison to our equation and their actual resting metabolic rate. However, if you notice here, this is our predicted equation and this is their actual measured, indirectly measured resting metabolic rate. They were almost identical, which was really exciting. However, we were still curious into understanding how that resting metabolic rate could be being influenced by their nutrition. So we decided to look at the relationship between intake and estimated need from their self-report. And there was over a 600 kcal difference between their intake and estimated need, which means that every adult participating in this study was significantly under-consuming compared to their fuel need. Now, do we know how much of an impact that has? No. But if we think about the future directions, it's important that we start thinking about how we can standardize lean body mass and resting metabolic rate in monitoring that long term. So a next step would be to see how these numbers compare over time throughout all 5 visits, not just visit 1, which is what we looked at in this data set. Also, utilizing the most updated prediction equations and recognizing that they are specific to populations. Do you have any questions? Yes.
So, I apologize, I can't see this here, but so your last 2 bars in your bottom middle graph.
Yes, here.
So actual and predicted. The predicted is your regression equation
yes.
from this data.
Yes.
I guess I wouldn't get too excited that the mean values are exactly the same. That's a property
Yes.
of regression, right? So it's really like, what's the aggregate error across the individuals that you want to be looking at in terms of how good the prediction equation is.
Okay.
Are your predictions in kcals?
Yes.
Okay, so from your resting metabolic, the actual indirect calorimetry, what equation did you use to convert oxygen consumption and CO2 into kcals?
Dr. Herta?
Was it the equation?
Probably. The weird equation.
Like from 1947, there's no other guy named Weir. So.
I think that is what Patty
Yeah.
modeled the
Yeah.
Parvo empirical equation.
Okay. Just checking.
Yeah.
I would say, though, along with that, the biggest limitation of this study is that all of our estimated values are based on self-report, and so we have to recognize that when we do look at this and understand how well individual patients know their dietary intake. Yes.
I was just going to mention that. I think typically
Yeah.
people underreport their nutritional
Mm-hmm.
intake.
That's what I was going to ask.
So that's one, but also the fact that, I mean, you're right, it was previously mentioned by Tricia, that people are in inflammatory states, so they're probably the immune system burns up a lot of calories. So they probably are a little bit malnourished, but probably not to that extent, I'm guessing.
Yeah, so we had the sports nutritionist would evaluate all of them, and she would kind of consult with them when she was having them record what they ate. But sometimes when they're laying under the hood for 15 minutes, they're like, "Oh, I forgot to write down those 15 M&Ms." And then we like add to the food log, and I'm sure there's a lot of other things they didn't add.
Any other questions?
Any more questions? All right, we're good.
Okay, thanks.
Thank you.